All right, now we're going to take the medical approach to really learn what medical treatments that doctors that specialize in hair loss can help you with. And then I'm going to introduce you to some of the best practitioners in the world. So first, biopsy. As you heard me talk about the scalp check, which is a very sophisticated level of understanding the science of the hair and the scalp, biopsy goes out and takes a section of skin with follicles and they examine it. They're looking for the relationship. Is there alopecia? And that's more likely when you would go for a biopsy. Alopecia is an autoimmune disease that creates the hair follicle to become a disease to the body, and the white blood cells attack. So that's what they're looking for most of the time in biopsy, but they can learn some other things. The tools that they have, or the products, or the protocol of prescription would be Rogaine. Rogaine topical is the ability to hopefully work through the process of stimulating some growth. Then they'll recommend possibly biotin or some strong level of food supplement that has biotin in it that will give you the ability to truly nourish the follicle. Over-the-counter shampoo or limited medicated shampoos are available for them to prescribe for you as well. PRP that you'll hear about is an injection of stem cells from your own body to re-inject it into the scalp to stimulate growth. And then there's the medical procedure transplant if you're a candidate. Let me introduce you to some of the best in the world doctors telling you more about these procedures and what they do for their patients each and every day. I've got Dr. Alan Bauman, which is internationally recognized as the best of the best. And it's not because he's a good friend of mine, but it really is his title in the industry of surgical transplantation and his center down in Florida. So let's not even waste another minute with introduction. I want you to take what he's got to be able to share with us in knowledge about hair loss and what you can do about it. Dr. Bauman, good to have you here on Hair Loss Solutions TV. It's been a while now. We were on just before the pandemic and we closed down our first season with the TV program.
Absolutely. Well, great to be back with you. Great to be back with you.
It is. Dr. Bauman, there has been so much media coverage. There's been so much concern about the shedding that's going on for everybody who's gone through COVID, or not even gone through COVID, gone through the stress of the COVID season, so to say. What have you seen in your private practice in regards to this, and what research have you found has been helpful for the people who are watching?
You know what? Over the past 2.5 years of this pandemic, I've seen so much pandemic-related hair loss. It's unbelievable. I've probably treated well over 1,000 patients with pandemic-related hair loss. And so, of course, we knew that serious infection and anything that kind of gives you a long fever, even a couple of days of fever, like COVID, SARS-CoV-2 infection, COVID-19, was going to give us some shedding. And we knew that from Spanish flu days. We're talking about, the early 1900s was really the first time post-febrile telogen effluvium, or shedding due to fever, was really published in the clinical literature. So we kind of knew that if you had a fever, you're probably going to see some shedding. But holy smokes, I mean, for a lot of patients, this shedding phase just seemed to continue on and on and on. And in many folks' situations, they had hair loss to begin with. They could have had male or female pattern hair loss, and that situation accelerated and got much worse after becoming infected. And so we really needed to step up the battle in terms of diagnosis and treatment for sure.
And a lot of the medical practitioners were saying, hey, it is a stress hair loss and just don't worry about it, and it'll grow back, as it typically would when there's a short term of a fever, or even after childbirth or menopause. There's that short term of the loss of hair, the shedding. But this long-term relationship, is it more possible to be creating a permanent hair loss, or generating even a greater loss of female and male pattern loss?
Well, what I've seen is that it's really related to the underlying comorbidity. So if someone is more prone to hair loss, let's say they have the tendency towards male or female hair loss, and they get infected with COVID or the stress of the lockdowns, what have you, you're going to see that situation accelerated. So it might be a shedding phase, but then when you come back and do the measurements, it's not just this shedding that's happened, but actually a massive progression and acceleration of androgenetic alopecia, which is female and male pattern hair loss. Sometimes we saw a trigger of alopecia areata, where patients who had been in remission from alopecia areata for many, many years got an infection or got through the stress situation, and then they had spots reappearing all over the place. I have a colleague of mine who is a plastic surgeon who had a small alopecia areata spot kind of coming and going on his leg, and got infected with COVID, and boom, all of a sudden he had alopecia totalis all the way across the scalp, eyebrows, eyelashes, and everything. So I think it's going to affect various people in different ways. We've certainly heard about the long COVID patients. There are Facebook pages dedicated to these folks, and you've seen celebrities, Alyssa Milano and the likes of who've been complaining about this chronic shedding process that just keeps continuing over and over again, even after their COVID infection theoretically is gone. And so I've seen a lot of that as well. And so it's been a difficult situation for a lot of folks out there. And even those who have not been infected with COVID, the stress of the lockdowns, changing their lifestyle situation, maybe not taking such good care of themselves, not exercising or sleeping as well, or doing toxic behaviors, with alcohol and other things, other substance abuse, has really accelerated hair loss in a lot of folks. So it's a pretty bad situation out there, and each patient has a different story, and it's not a one-size-fits-all diagnosis, and certainly not a one-size-fits-all treatment. Every patient is completely different.
Yes, and I've even seen an increase in the trichotillomania patients that we've had just from that stress and that compulsive disorder being motivated by this kind of stress.
Absolutely. So across the board, any of those conditions, especially the psychological obsessive compulsive conditions like trichotillomania, all of those got worse. I mean, in my spare time, I volunteer for Gray Team, which is a 501c3 that takes care of military veterans to try to prevent PTSD-related suicide. And we know that suicides have gone up dramatically over the course of the pandemic, military and non-military. Thankfully, we haven't lost any in our program, but it's, we know that depression, anxiety, and all of that, on top of the allostatic load, all of that other stuff that stresses us out, is not good for our hair, for sure, as well as our other organ systems, whether it be digestion and sleep and you name it, brain function and immunity and everything else. So,
well, now with the bad news that is an issue, and it's a fact, and you've given people that maybe were questioning it a medical understanding. Now, what can they do about it? That's been the entire series that we've been trying to give people from home to trichology to surgery to medical procedures. What can they do to help them get through this and make it better?
Yeah, so the first most important thing is that if you think you're at risk for hair loss, or you've seen some shedding, or you're seeing changes in the amount of coverage on your scalp or your ponytail volume or changes in your hairline, you've got to get the correct diagnosis. Because if you're trying to treat one thing and your diagnosis is something else, then you're going down the wrong path, and you're not going to get results from that therapeutic intervention. And that's, I think, what steers folks in the wrong direction sometimes, because they look online, they're looking for some magic vitamin or pill or some special hair care product. And even though there are some very good nutritional supplements and excellent scalp care products out there, if you don't know your correct diagnosis, then you're going to be chasing up that wrong tree there for sure. You're not going to be getting the results that you expect. So finding a board certified hair restoration physician, even if he or she is not in your local area, connecting with them virtually, or even better, getting into their office to really figure out and measure specifically what the hair is doing in each different zone. I mean, that's a critical step. So you'll know whether a shedding phase is causing an overall loss of density, or whether maybe you're getting a shedding phase from starting a therapeutic intervention, like with red light therapy, laser light therapy, or treatment like a topical minoxidil, or therapies like PRP. All of those therapies that kind of click into gear and stimulate anagen, which is the growing phase of the hair follicle, can sometimes result in a shedding before you see the regrowth and feel the regrowth really on your scalp. So it's important to have those measurements as a part of your diagnostics, so you can track over time exactly what's going on.
You know, for the listening audience, that's really a gem that you just went through. The reality of, even if the process is looking like it's getting more shedding because you're in a proactive way of treating this hair loss, you may see some additional. And what most people do is they stop. It's almost an antibiotic. They stop when they feel a little bit better, and they get worse. And I think that you've given at least the listening audience that are listening that you don't stop. Once you get a good analysis of what you're going through and what you have as a hair loss issue, then to follow through with that procedure and the protocol that your doctor or your trichologist give you. I think that's so important.
Yeah, and that's critical, because, for example, a lot of women come in and they have shedding phase after, let's say, childbirth. And of course, everybody kind of expects that their hair is going to, come back to a more normal density, if you will, and ratio of resting to growing hairs once you give birth. But a lot of women are not expecting that female pattern of hair loss to persist after that childbirth. And so what is that shedding phase revealed? It's revealed that underlying comorbidity of genetic susceptibility to female pattern hair loss. And so if you use that as an example, it's the same thing that we see with the lockdown stress situation, the effects of cortisol, as well as the actual infection of COVID-19 itself. And even sometimes the vaccination and boosters can really ramp up your immune system. And that can cause some havoc as well for hair follicles and hair growth patterns.
Dr. Bauman, you've given some of the reasoning and things that they should do for finding out where they're at in regards to the hair loss. Now, what are the things they can do, like shampoos, conditioners, lasers, PRP? What is in their ability to find out about today are possibilities for their hair loss solution?
Yeah, if you're dealing with an acute shedding phase, the good news is that there are therapies that can help. So we've had great success with our versions of PRP, topical medications, and laser light therapy to really help with the shedding from the pandemic stress situation, as well as the infections with COVID and long COVID. But as you mentioned, nutritionals and nutraceuticals and scalp hygiene is really, really important, because what can happen, for example, let's just say if you're having an exacerbated stressful situation, we need to make your body more resilient to stress. And so one of the things that I like to use in those specific situations is an herbal supplement called ashwagandha. And under the Bauman MD brand, we have something called the Zen Master, and that we routinely prescribe. We can barely keep it in stock for those who are experiencing high stress. And that's just about every single person in the global pandemic these days, it seems. But what ashwagandha is, it's an ancient herb from the Far East that makes your body more resilient to the effects of stress and cortisol. So it's a really, really good herb, no side effect herb to have on your, in your armamentarium, so to speak, if you're dealing with a stressful situation. Now, of course, once you've kind of mitigated the effects of the stress cortisol, then you can move forward with other things such as the PRP and laser light therapy, topical medications, and so forth. These regenerative treatments like PRP and PDO Grow have been very effective for our shedding patients and our COVID patients. And if you combine that with either prescription oral minoxidil or topical minoxidils, those can be very effective as well for both men and women.
Now, everybody has heard at this point, or most of the people have heard about PRP. I'd like you to give a good, layman's explanation, but you have had, and I've been in your practice and I've watched you do it. The reality is you do it a little bit more under the Bauman study. So tell us what PRP is, and then how you have kind of worked with it to make it even better.
Sure. So PRP has been around a long time, probably 2 decades already. Platelet-rich plasma is what it stands for, and it's really the workhorse of regenerative medicine. And most people are familiar with stem cell or cell therapy in orthopedics or sports medicine. If you have an injury in your joint, like a knee or something like that, today's athletes, they don't get cortisone injections into their knees anymore. Typically, they're going to get either something like either stem cell therapy or PRP. And PRP is derived from your blood platelets. And the reason why we like blood platelets is because they contain a payload, if you will, of growth factors that are helpful for tissue regeneration and repair. And so when we do PRP in the office, we're going to take a small blood sample and we're going to spin it in a centrifuge. And the centrifuge is going to help us separate and concentrate the PRP in a very, very special way to get a high concentration, an exact concentration, if you will, of the dosage of platelets that we want. And that PRP is going to be applied then painlessly into the scalp because we use local anesthetic to numb the scalp, and then the injections proceed without any discomfort whatsoever. And so the injections are placed into the scalp in the areas of concern, and the PRP is then activated. And there are a few other steps that we do. We use laser light therapy. We also use microneedling and some other growth factor topicals on the scalp at the same time. But the point is for those platelets to release their growth factors and trigger the hair follicles to enter or stay in the growing phase. And that's really the main idea. So what we do differently is that we don't do a series of treatments. You don't have to come in month after month. You're not booking 3 or 6 of these. You're going to do 1 per year. And the way that we've been able to design that is because I have a device that actually measures how many platelets are in your whole blood that we take from you. And then I measure the platelets in the final PRP that we've created. So we just take 1 little drop of PRP, we can measure exactly how many platelets are in that PRP. And there's a specific dose of platelets that's going to give us the strongest and longest effect on the hair follicles. So it's a nice way to do the procedure. Our results last about 10 to 14 months in terms of the boost that the hair follicles get, and we measure that over time. But there are other things that we could do in addition to PRP. We also have PDO Grow, which is a procedure that uses the PRP that we just described, as well as the use of absorbable threads into the scalp, as acting as a scaffold, if you will, to help make the PRP last longer and be stronger. So polydioxanone threads are used in aesthetic medicine for wrinkle reduction, for collagen improvement, for skin tightening and things like that. And we can use those in the scalp at the exact same time as the PRP to enhance the effects.
That is interesting.
So that's a really nice, that's in our armamentarium now of regenerative medicine treatments, as well as things like exosome therapy as well.
Okay. Nutrition and taking care of your body, exercising, oxygen. I know you mentioned it a little earlier in our interview, but why don't you encapsulate what a person should be doing on a basis to help their hair? Because so often we think of weight for doing exercise, we think of eating maybe for your skin, but very seldom I think that even in articles, they talk about this exercise and nutrition affecting the hair in a positive way.
Yeah. So obviously, hair follicles are a very highly metabolic cell population. And that's one of the reasons where there's such a strong barometer of our health and wellness. And so, of course, our nutritional intake is going to determine whether your body knows it has enough food to produce the hair fiber, right? Actually, it takes a lot of energy to produce hair. Think about 630 kilojoules, if you will, to make just a little gram of hair, which is about as much hair as you could stuff into a sugar packet, essentially. And that requires about 15 minutes of vigorous exercise if you're trying to equate, 600 kilojoules or so. So your body does require a lot of energy. And so there are, aside from protein, obviously you want to make sure you're having good protein intake, that you're not caloric deficient, that you're not anemic or iron deficient. There are many other things that you can do in terms of supplementation to improve hair growth. Probably the most well-known one is biotin. They call it vitamin H. H stands for hair, B7. And it's very safe. It's not that expensive. It's a relatively inexpensive supplement to use. We like 10,000 micrograms. In the practice, under the Bauman label, we call it the hero because it's a hero for hair growth for sure. We also have collagen replacement, and as you know, anytime you're over the age of 35, your collagen production goes down over time. It's one of the reasons why our skin sags and our hair weakens, and so we have collagen replacement called the Builder, which could be used in coffee, tea, juice, or water. We also have a general multivitamin called the A-List. But one of the most important things I think is for today is our probiotics. And many of us have heard of the microbiome, which is the sum total of all the microorganisms that we carry around with us in our GI tract, right? These are symbiotic organisms that work with us to help us metabolize food and create vitamins for our well-being. They also help regulate inflammation. They teach our immune system what to recognize and what not to recognize. They help also regulate our emotions. So our microbiome is really, really important. And one of the first things that gets disrupted with stress and emotional issues and things like that is our microbiome. So we've developed a probiotic specifically for the microbiome of the gut, which is good for hair growth. And we call those the good guys. So that's one of our nutritional products under the Bauman MD brand. And so, when you start combining these things like, biotin, the hero, and then the A-list of multivitamin, and then the collagen, and then the probiotics and so forth, you can really start to give yourself some good nutritional supplementation specifically tailored for your hair, which is nice.
Well, you have given us a wealth of information. We've got your links down below that everybody can tap into, not only personally getting a virtual or a live consultation with you and see your beautiful center, which is just incredible, but also all of the things that you have in your store so that they can really do something proactive. That's what this series has been about, and that's why I held you as the last one of the series, because I knew that you'd bring to the table a generous amount of information and knowledge, but also solutions, which are so important for us. But I thank you for being with us, Dr. Bauman. Continue to bring this research to us, and we'd love to have you on again because you just bring a wealth of information for people really looking for solutions in hair loss.
Well, it's my pleasure, Jeffrey, and I hope, if any of your listeners and followers have any questions, they can always reach out to me and I'll respond personally to their questions.
Thank you so much. You have a beautiful day.
All right, you too. Take care.
And if you have questions in anything in hair loss or hair thinning, please put them down below and we will come back on our answers on questions that you have for us, because as you ask the question, we then do our research and bring you people like Dr. Alan Bauman and others that have the answer that really is not just a fantasy, but something that you can put to practice and be proactive in your hair thinning and hair loss. They look beautiful inside and out. If you want more information, my book has a whole chapter on the medical approach to hair loss solutions. You can get that by simply clicking down below, and Amazon will send you probably tomorrow morning your book. Continue to look through the process of these episodes to find your best fit, or maybe the combination of best fit for you. But I want you to know something. There is an answer and a solution, and it isn't just wait, and it isn't just let it go until it becomes better. That's not the way to deal with hair loss today, especially under the stress of COVID, pandemic, and all the other issues that we're dealing with on a day-to-day basis. Do well each and every day to have your ability to look yourself, live your life with beauty inside and out. I'm Jeffrey Paul. I hope that you visit me at my website, Jeffrey Paul, Hair and Scalp Specialist, and maybe join us there live in person and introduce yourself. I'd love to hear what you think about this whole series and episodes, and if you want more, let us know. At the Hair Loss Solutions TV, we will continue on a weekly basis bring you knowledge and breaking news in the regards of hair loss solutions, and the way to look beautiful inside and out. I'll see you again very soon.